For anyone who's just joined, we're just going to wait a few minutes to allow some more of you to join and then we'll get started. Um, and just to let you all know who wasn't there before I mentioned this, but most of the questions, if possible, we're going to do at the end. Um, but yeah, just going to wait a few more minutes.
Wait, sorry, there was just a quick question I saw about the foundation year interview material. I think you're talking about the BM6 program. I'm not too sure if the interview's like different for the BM6 program. Um, I'm BM5, so I only know about that, but I could find out for you if that's okay. Yeah.
Yeah, and we'll be giving a lot of general things that will still apply to all of the programs. But yeah, both of us are BM5, which we'll explain in a second when we get going. So I reckon we should probably get going soon-ish.
That sounds good. Yeah.
Yeah, okay. Let's get cracking then, I reckon. And then people can just carry on joining. Okay. All right. You happy to start?
Yeah, I'm ready.
Fab. So we can go on to the first slide.
Oh yeah, sorry. I've
It's all
completely
right.
forgotten that.
Okay, so hey guys, we thought we'd introduce a bit about both of ourselves before we carried on with the presentation because I think it's always good to know the people that are talking to you. Um, can I talk about myself from memory? The next question. You okay? Ah, okay, so my name's Harriet, and I'm a current fourth year medical student at Southampton. So, in about 18 months' time, I'll be in FY1, which is a little bit terrifying, but also very exciting as well. I grew up in Edinburgh before I moved down south for sixth form, and stayed down south, obviously, for university. I'm currently on my acute care placement, which I'll go into in a bit, but it basically involves a bit of ED, a bit of anesthetics. I'm currently doing quite a lot of AMU right now. So it's all very acute care focused. And my top two clinical specialties I'm thinking about are obs and gynae and pediatrics, but I'm very open to most of the specialties. Outside of medicine, I really enjoy running. I also do medics netball, which I'll also talk about a little bit more. Outside of my studies, which is good for relaxing. And to be honest, I enjoy just spending time with my friends. And if there's coffee involved, then I'm nearly always down for anything. So that's a bit about me. Oh, you're on mute.
Sorry. That hi everyone, I'm Sadiksha, and I'm a first year medical student, and I'm on the BM5 program like Harriet. I grew up in Reading, which isn't too far away at all. I just finished my first set of exams this week, which I'm so glad they're done. What am I really interested in? Well, our first module, we did a lot of oncology. And lots of cases surrounding cancer. So far, I'm really interested in cancer immunology and oncology, which Southampton is the perfect place for because it's got the only cancer immunology centre in the UK, which is really exciting. I'm part of the University Air Squadron. I don't know if many people know about it, but it's just RAF cadets at university. I'm a big fan of flying, as I did RAF cadets at school. And then there's sports societies within Air Squadron itself. So I do some cricket. Um, I love playing pool with my friends at the student union, and I do love matcha. Cool. Okay. So I didn't. Okay, so this is just like an overview of like what the teaching is like. So it's quite integrated teaching style. So we'll have lectures, and then based off of those lectures, we'll have tutorials, which kind of just help us work through like problems they give us based on the lecture material. We also have seminars for some subjects where they just want to hear like more from us. And also, it's quite practical as well in the sense that we have GP teaching groups, so we like learn how to do observations and things like that. And then we also have our GP placements, so where we go see patients who will have like the condition that we're studying. So that's just a bit about that. Um, the course itself is slightly more traditional than some universities. So year one and year two are mainly preclinical, with some exposure early on. My year's got the new curriculum, so they've increased clinical exposure a lot. So I'm at GP a lot, or with my GP teacher, learning about how to deal with patients, and just things like that. And we have anatomy twice a week in the labs in the hospital, and I will talk more about that later. And it's currently split between teaching on the main campus and Southampton General Hospital, where they have an academic block. That's where we all go for our lectures. However, there is a new medical building under like construction on campus. Um, so we just wanted to show you what like life is like for us as first years and fourth years. So this is my timetable as a first year. Uh, so it's quite so the things in purple are lectures. There usually are quite a lot of lectures. And then the ones in pink are the anatomy lab um sessions where we're with the cadavers and looking at the prosections. And then we have tutorials in blue. So if like we've covered something last week or the week before, you have a tutorial on it where they just give us problems. Um And yeah, so it's like there's a lot of variety. Like Thursday afternoons is usually the more clinical part every week. So we either go to our GP teachers or we have GP placement. And most our lectures are at the hospital. So Monday, Wednesday, Friday, our lectures are at the hospital. On Wednesdays, we have the afternoons off for sports and societies, which is really good. And that's for all universities, which is it's really nice to have some time off. Um, I feel like people are always worried about like a course in like medicine's quite an intense course. You didn't get much time for yourself. But I go to the gym 4 times a week, like in with this quite busy timetable. So it is possible to do things you like. On the weekends, I catch up on work, hang out with friends and do errands like laundry and meal prep. Um, but yeah, that's a little bit about a week in my life. Um, so a little bit more about anatomy teaching at Southampton. So it's you have dissection and prosection. So at Southampton, you do prosections, and this means that the cadavers are prepared for us. So there'll be the anatomy teachers who kind of cut things in a certain way just so that we can see certain structures specifically, and they supplement our anatomy lectures for knowledge, but also the case that we do for the week. So each week we are given a case for the week, for example, obesity, and then or like something like hypothyroidism, and then like the anatomy sessions reflect whatever we're learning, which is really, really useful. The labs are set up into stations and in groups who work around the stations. And we get sent like prep work, so like a PDF that has like all the things that we need to know for the anatomy session. Each station has a few set of questions for us to apply the knowledge that we've looked at. So finding landmarks, specific vessels, or associated pathologies. We also interpret imaging during these labs, such as brain MRIs, as well as histology and chest X-rays. So all sorts of things to really to apply like clinically what we've learned. Cool.
Okay. Um, my timetable is a little bit more homemade than that lovely timetable. But I thought I would talk you through my week because it does look quite different now being in the more clinical part of the course. So I am currently in full-time placement now as a fourth year It doesn't mean that I don't have any lectures, but I have significantly less lectures than the early years. Um, Maybe two or three per placement. Each placement is slightly different length, but they're all sort of on average about 5 to 6 weeks long. Sadly, I don't get Wednesday afternoons off anymore, which is a little bit sad because I did quite enjoy how they broke up the week. So it goes without saying, obviously, each centre in Wessex will look a bit different. So at the end, sort of during third year, we get to choose a zone that we want to be placed in for fourth year, and these zones are like north zones, so that's more towards London, kind of like Reading way, and then zone one, which is normally kind of in and around Southampton area, so like Winchester, Salisbury. And then you can go slightly further afield, so we can also go to the Isle of Wight and Jersey as well. But that's up to you where you want to go. And some students they choose to be nearer home so they can commute. It's completely up to you. Yeah, but I am expected to be in every single day. Obviously, every day varies a bit, but that's what's expected of you. And on top of what the university wants us to do for each placement, we also now have GMC sign-offs to complete. And the GMC sign-offs are basically a list of competencies that the GMC expects you to be able to do as a foundation doctor. So it's things like performing an ECG, do cannulas, bloods, that kind of thing. So we're expected while on placements to get these signed off, basically. So I'll just talk through a week in my life. I had to write it out because they don't really give us this as a nice looking timetable. It looks a bit messy. But this was actually this week. So I've just written out what I had. This week was my first week in Bournemouth for acute care. So I'm living in hospital accommodation currently, which is free. So if there is accommodation, you're given it for free. So Monday morning, I had induction in the morning because it was a brand new hospital. So we got a tour, we got told what the expectations of us were, given our timetables, our supervisors, all that stuff. And then in the afternoon, I was on AMU clerking. So I basically went to AMU. I asked the doctors if they had any interesting patients, and I went to take histories, examine them, and present to the registrar. And then we just talked through some of the management plans for these patients. I got a bit quizzed on what I thought, like what investigations that I would do. So basically, it's putting into practice all the learning you've done in your lectures in year one and year two and year three. That's why that's so important. And then on Tuesday, I was back in AMU clerking from 8:30. And then at 2 p.m., I had bedside teaching. Bedside teaching starts from when I was in year two, it started in year two, which is really beneficial. It's you, maybe another person, and you go with a doctor to see patients, and it's what it sounds like. They teach you things by the bedside. So they might ask you to do an exam, and then they'll critique you or show you how you can do something better. And I always find this really helpful. And then on Wednesday, I was in SDEC, which is same day emergency care. And that was about 8:30 to 5. I spent time with the consultant on the post take. And then I spent time with an F1, just kind of shadowing them, seeing what they were getting up to. So that was quite an interesting day. And then on Thursday, I had OPAU, which is Old Person Assessment Unit, I believe. And that was really interesting because I got to go clerk a patient who actually was very delirious, which was a new experience for me. I had never tried to clerk a patient that was that delirious before. So it was definitely an interesting experience, but a very valuable one. And then again, I had bedside teaching, I think around 2 p.m. again. And this was similar to on Tuesday. And then today I was on HASU, which is the hyperacute stroke unit, with the stroke team. So I had some really excellent teaching on strokes, which you do a lot about in second year. So this was a good opportunity for me to kind of consolidate all my learning from the more preclinical years. And I got more learning again. We also had three thrombolysis calls, which was when they're called to normally ED with a patient that's literally just presented to ED with a stroke. So that was really interesting because you learn about it And then the great thing is on placement, you get to see it firsthand. So you get to see a patient who's come in, who's had an acute stroke. You can actually see the way they're presenting, that facial droop, the dysarthria, which is like slurred speech, all that kind of, you get to see it for yourself. And that was pretty much all day today. I think I got back to my accommodation like five-ish, so it was quite a long day. And yeah, now I'm done for the week. So I'm staying to do this, and then I'm going back to Southampton. Um, and then this weekend, probably do park run tomorrow, see my friends because I'm obviously away from them during the week. And I will get some work done, hopefully. Just kind of summarizing what I've done this week and making sure that if I thought anything was particularly weak during the week, that I'll go over it again at the weekend. And then yeah, back here on Sunday evening for another week. So that's basically what my week looks like this week. But it is very variable in fourth year. It really just depends what placement you're on, what center you're at. But essentially, you are just experiencing what life will be like as a doctor at some point. So, yeah. Okay. And then I thought I'd talk a little bit about extracurriculars because the great thing about Southampton is there are so many to choose from. So you've got the medicine-specific societies. There are loads of these. So you've got the academic ones. There are things like women in surgery, anesthetics in critical care. There's GP society. You've got the pediatric society, and then you've got things like Teddy Bear Hospital, which is like a side branch of the Peds Society where you can go to local schools and interact with children about, what vaccinations are like, getting them familiar with medical equipment. It's all kind of things you can do outside of the normal medicine curriculum to enrich your learning and maybe find a passion that you're interested in. There are also loads of medicine specific sports societies. So you've got things like medics netball, which I do, medics football, hockey, climbing, running, rugby, cricket. There's loads. Honestly, like you will find something that you'll enjoy. And I think the really good thing about having so many medicine specific societies is that you can really find a community of people who are like-minded, who understand the workload that you're going through. Often the training sessions are built around your schedule. So because it's a medicine society, they're not going to have training in the middle of the day on a Thursday because everyone's got lectures and placement and things on. So that I also thought that was really good. And I think I'm a bit biased because Medics Netball was probably one of the best things that I ever did. But I do think that one of the good things about being in a medicine society is that the older students support the younger students. Like when I was in first year, the third and fourth years would run revision sessions for us before our exams. Because they've been there and they've been through what you've been through, and they're a good support network for you. And it's quite a nice full circle moment that now I get to run the same revision sessions for the year one and year twos. So that's nice. I think that's just like a nice thing. And then obviously you've got all the uni ob societies as well, all the buck stuff, like all of that, if that's what you're interested in. And then also there's quite a few tutoring and mentor schemes available to you that float around on the WhatsApp. Various opportunities for some for younger years too, but also for older years to aid the younger years learning. There are programs that you can join. You can join things like widening participation, do work in the community with schools, trying to get people into medicine. I know there's no longer a research project, which is what I had, but there are some great research links that are still there for you if that's something you want to explore. So you've got all that alongside medicine, which I think is really special about Southampton.
Yeah, sorry, I just wanted to add about the research thing. That if you just talk to a professor, like if you attend a lecture and a professor mentions some of the research they're doing, you can just email them and just ask, like, you know, would you mind if I came in and like helped out? Like there are ways like to get involved with research, even if there isn't a research project anymore.
100%, you just got to ask.
So that was a bit about Southampton itself, the university. Now we're going to talk about the interview, like the interview. So what the interview process entails, like the panel interview, the group task, and like our advice for the interviews. Ooh. So there are two stages to the interview. So you come in for a selection day, and in the selection day, you have to do a panel interview, and then you'll do a group task. In no particular order, but so the group task, there are 7 to 8 people like per group, and you're all put in a room and you're all given a piece of paper that has a task on it, and you basically have to solve the task and just work together as a team. So really, they just want to see how well you work in a team, replicating the MDT in a clinical environment. And I really don't think they care about you solving the task. It's more about seeing how you work in a group dynamic and making sure that you're just someone who can work in a team because that's such an important part of being a doctor. But yeah, that's really all that the group task is. Like I'll speak more about like my advice for the group task like later. But yeah.
Okay, and then the panel interview. So this is about 20 to 25 minutes. I think it can slightly vary time-wise depending on how long you take to answer the questions, but that is what it's like on average. And I believe it's usually with two members of staff. So for my panel, I had an anesthetics consultant and I believe, a member of faculty. I've tried to remember so many times who it was, but I've never worked it out. But they were definitely a member of the faculty. And Southampton in particular is very heavy on personal statement. So they will use your personal statement to guide the questioning. But don't, so obviously, learn your personal statement like the back of your hand, be able to talk about everything on your personal statement. Even if you think it's a small thing that you may have just thrown in there, they could choose that to pick out. So just make sure that you can answer questions on any aspect that you mentioned. So if that was like a book you read or something, but I'll go back to that in a bit as well. There will also be, sorry, there will also be questions on the NHS hot topics, so things that have been floating around the media, like junior doctor strikes, for example, decreased vaccination uptake. I literally just saw a notification about some sort of prostate cancer medication earlier on this evening. So it's that kind of stuff that you want to be reading. They will also ask you ethics, so your pillars of ethics, you need to make sure you understand them. And then the skills that are required to be a doctor. And those are all kind of your general things that most universities will ask you about. The only difference is that it's in a panel format. So you are with the same two people the entire 20 to 25 minutes rather than bouncing around different stations, which does mean that you can elaborate a bit more in your answers. And then I screenshotted this because I read the website just to double check I hadn't missed anything. And they do list these arrows of things they want you to demonstrate. So these are on the website if you want to read them yourself. But so to demonstrate that you're self-motivated and resilient, that you've reflected on relevant life experiences. Reflection is very important. Just make sure you can reflect on things that you've mentioned, that you can communicate effectively, that you can interact successfully with others, also hence the group task as well, and that you understand the values of the NHS Constitution. So the fact that they actually list that, I would definitely follow the link to the NHS Constitution they give you and just make sure that you know what they are. I think I want to say there are six, but I might be wrong. But definitely make sure that you know them because they've listed them for a reason. So that's worth checking if that's not something you've previously checked before. But yeah, I think that's the main things for panel. Oh, I'm talking about that right now. Um, Yeah, that's fine. So both of us thought we'd give our advice for interviews because obviously my interview was in 2022, so it was a few years ago now, but I thought you could have perspectives from two different people would be good. So I genuinely enjoyed this interview a lot more than the other interviews that I had, which surprised me because panel was something that I found quite intimidating, the thought of, but it doesn't have to be. I thought that this was the interview where they cared about me the most as a person. So I would say to you guys to not be afraid to show your personality. Obviously, maintain, be professional, but there's show them bits of yourself, like show your passion, give answers that show them more about you as a person. Because at the end of the day, they're just trying to evaluate if you would suit Southampton Medical School, and hopefully you guys all believe that you would. So it's just about showing them that. Just as I mentioned, make sure you can reflect on anything you've mentioned. So it could be that you've done work experience, you volunteered somewhere, you've written an EPQ, or maybe you've written a magazine article or something. If you've listed any of those kind of things, just make sure you can, list your findings, talk about it, reflect on what it taught you. That's very important. Be engaging with them. So because it's the same two people for 20, 25 minutes, it's really important early on to try and get a good relationship with them. So I know it's really easy when you're nervous to, maybe not be as smiley and as engaging, but really try and maintain eye contact, be smiley, engage them, and that will help. That will go quite a long way. And then my last point there is also what I briefly mentioned earlier. Try to keep on top of current medical news. So I mean, you could read the BMJ if you really wanted to, but it's meant for a level that's potentially slightly complicated for you guys and for me. Like, I think I'd find the BMJ quite overwhelming, some of the articles. So, if you just want to make sure you're up to date, I say the week before your interview, start checking BBC Health. Just check it like every day, 5 to 10 minutes, go through some of the articles, have something up your sleeve if they ask you, and just make sure that you understand things like the doctor strikes and what's going on with that, because they may well ask you. But yeah, those are my main bits of advice.
So my advice is just to know your personal statement inside and out. I feel like Harriet has mentioned it, but it definitely is an interview where, like, as Harriet said, they want to get to know you. So knowing your personal statement, like, is a really, really big part of it. So Southampton is a university that does care about who you are as a person. And in the group task setting, there are eight of you, and there aren't going to be eight leaders. Like, it's just not going to work if there are eight of you just trying to be leaders in the group. Like, and that's okay. Like, if you are someone who isn't as, confident and out there, that is 100% okay. They're looking for people who can work well together in a team, like people who can contribute and give good ideas. So you don't have to be the person who's leading everyone. You just have to be the person who's making sure, like, you're including everyone and just being a good team player, if that makes sense. Um, in the group task, don't be afraid to challenge other people, like in a polite way. Um, they really like that if if you're challenging other people in the sense that I really understand your point, but could we maybe look at this in a different perspective? They really like that because when you are working in an MDT, um, you're gonna have differences in what you think's right for the patient, but it's like discussing those different ideas is what brings out the best for the patient. So I think that's just what they're trying to simulate in that sense. Um, for the panel interview, I think I had three interviewers, and that can be really daunting. And like, it is so okay to be nervous. Like, they 100% do get that. Like, if you feel like you've messed up or you're just kind of stumbling over words, just pause, breathe, smile, like just take a few breaths and just carry on. Like, they won't mark you down for like stumbling over a couple of words. I think it's just about how you pick yourself up afterwards. And then just smile. I just feel like if you smile, it just mentally just makes you feel better, and it like makes you seem like more approachable, and just I feel like faking it till you make it. Like, even if you are super nervous, just smiling just kind of makes you feel better. And yeah. Um, wait, what's next? The next thing we just wanted to talk to you about was, are we glad that we chose Southampton? And Harriet's gonna start off with that.
Yeah, so I think the answer for me is definitely 100% yes. Obviously, we can't speak about what other medical schools are like because we've only experienced Southampton. But I generally have really loved my time, and I'm honestly quite sad that I haven't got that much longer left. I really love the community that you're a part of. I think with some medical schools, like the medical school itself is separated from the main uni. So you might have like your complete own campus or not be around other courses. But I think what I really liked is that especially in the early years, you do have teaching on campus on Highfield, which is the main uni campus for most of the courses at Southampton. So I always felt like I was very much a part of the main uni, aside from doing medicine. So I felt like I had a great uni life experience, even though I was studying a degree that is a more demanding kind of degree than most other degrees. So yes, like I couldn't go clubbing during the week and I couldn't do things that other students can do when they're not doing medicine, but I never felt like I was missing out. I always felt like I was part of this community, which is very nice. SGH itself is a really great hospital to be in, so that's Southampton General. Sorry, if people don't know. But I think I recently found out that it's the second biggest hospital by bed capacity in the UK. I mean, you can double check me on that, but that really shocked me. But it does mean that when you're on placement there, and you will get some placement there in the early years too, you do get to see patients with presentations that you just won't find anywhere else because all the amazing cases and the complicated cases come here. We're also a major trauma centre, and you get some ED experience in the early years too. Because we're a major trauma centre, all the massive kind of like road traffic accidents in the Hampshire area get taken to SGH. So without sounding too much like a psychopath, obviously, it is a great experience to witness those kind of traumas from a medical student perspective, of course. Um, I also felt like because it's such a big teaching hospital and because it's very well established, most doctors that work at SGH are great with students. I've had nearly all positive experiences with doctors that I've been with. They're very keen to help you with your learning. They understand you're a student, you're included in lots of things. And yeah, I felt very supported throughout my entire med school journey. You're given a PAT, so a personal academic tutor in year one, which is somebody that's assigned to you. And if you ever have any problems, anything to do with med school, anything to do with your personal life, if something happens, then they're kind of your first port of call. And you can go to them for advice on what to do if you need to apply for special considerations for any reason, if you feel like you need some extra support. If you just want to talk to somebody, then you have someone there that's a contact for you. And the faculty are very encouraging to come to them if you have any issues. So I've always felt like if I needed it, there's somewhere to turn to, as well as all the friends that you'll make when you come here. And yeah, I've loved the real mix of learning opportunities that we get. Like, I really like the fact that I had early patient contact. I had lots of small group teaching to kind of build my confidence up and um, ask questions because I'm not the kind of person that asks questions in a lecture. Some people are, some people aren't, but I don't think I've ever asked a question in a lecture before. But I have asked loads in seminars and tutorials. So I like the fact you get that smaller environment where you can ask questions and feel a bit less stressed or judged or anything. And yeah, I am so glad that I came here. You know, I've made friends for life. I've had the best experience. And yeah.
Yes, I'm so glad that I chose Southampton. Because like the amount of support that I've received, like not like from not only like the staff but also the societies, especially during the build up to exams. Like, I feel like coming to uni, everyone was like, it's gonna be really, it's like a big transition. At school you have teachers, like, and at uni, no one really cares about you. And people were just telling me this kind of stuff. So I was really stressed out. Then I came to Southampton and everyone is just so supportive. Like Harry was talking about the community. Like we had formatives at our mock exams for the summer this week and like different societies held different revision sessions and mock exams for like their specialty. So the Anatomy Society ran a mock anatomy paper and the Neurology Society went over like the nervous system um like lectures to help us. Like it was so good because like if I was stuck with something, there was always a revision like session from the societies, but also revision sessions from like the faculty itself during our revision week. Um, because we're the first year with the new course, faculty like are taking our feedback really seriously. Like we fill in weekly check-in forms where if there's something we're not the biggest fan of in like during our lectures and regarding the way it's taught or just anything that we're not too happy about, like we'd mention it on there and they'll like at the end of every week they'll just kind of talk through any changes they put or something they haven't changed for so and so. Like they really do care about us and our experience, which is something I genuinely did not expect from uni. But yeah, I think that was just incredible. Like there is literally something for everyone. Like there are so many societies. Like if you go on the student union, Southampton Student Union website, like you will just like scroll for literally ages. That there's like so much you could be doing. And then the course itself, it's so practical. Like I was like in my GP placement week one of med school. That is like insane. And I didn't expect that. And my GP was like, "Do you want to take the patient's history?" And I was like, "Yeah, okay, sure." So I think that was such an amazing experience. I have a 4 hour shift in the emergency department at the end of January, which I just think is so cool. Basically, I just get to talk to patients, take their histories. Hopefully they'll let me examine them. Just things like that. But yeah, I love Southampton. I love the location as well. Um, and yeah, I just think that the professors are also really nice. Like, there was a piece of research I was really interested in, and all I had to do was just email the professor and like hopefully I'll like and I'm just talking to him about that and it's just really exciting. But yeah. We just wanted to open the floor to any questions now. Yeah.
Yeah. Hmm. Have a look in the chat. Okay. Okay. Is this still a spiral curriculum? Is one of the questions. So for anyone who doesn't know what spiral curriculum is, in the way that a spiral kind of loops around, that's what it means. So the idea is that you do something in the early years with the intention of going over it in more detail as you move through. So you start off with building a foundation and then move through. I don't think they mentioned the word spiral curriculum on the university website. I don't know if you've seen it. But from my experience, it has been a spiral curriculum. Like I've definitely gone over things again that I learned in early years in more detail. But I don't know if they've talked to you about spiral specifically.
It is for it the new course, it is a spiral curriculum. Like with we do go over topics again. So like we'll briefly cover them first year and then you go over them again second year, just with the extra depth of knowledge. So yeah, it is a spiral curriculum.
Yeah. The why medicine question. This is always very difficult because people will always tell you like try not to be too cliche. It definitely is a very personal question, but my advice with why medicine is always to try and find like a trigger, like something that made you think, yes, like this is what I want to do with my whole life. If you can try and find a trigger, because that's so personal to you, it's hard for anyone to turn around and say, what? Because that's your personal experience, is what I always like to say. And I also always used to use it as like a bit of a trap in a way. So I'd specifically mention things that I want them to ask me. So I'd say like I did my work experience here and it made me realize that this is what I wanted to do because I want you to ask me about my work experience, if that makes sense. But yeah, do you have anything else to add to that?
With yeah, so for like why medicine, I feel like you don't want them to follow up with why not nursing and like why not like research. So I think just making sure you have that balance of like yes, you're doing it for the patient contact, but also really putting emphasis on the fact that you really like research or science. Just making sure you've got like both because yeah, I feel like you really don't want them to follow up with why not nursing because then probably just means that you haven't mentioned enough about science. And medicine is just applied medical sciences, so you do have to like the science part of it to enjoy the course.
Yeah. Oh, we'll also reply to some of the, because there's quite a lot, I think if we can reply to some of them by text, but I'm going to try and read out the ones that I think are good for everyone too. Um, oh, what's been the toughest adjustment to make when starting life as a medical student? I'll let you go first because you've just started life as a medical student.
Oh, yeah, the toughest adjustment, I think just having to do everything for myself, like factoring in time to cook, factoring time to do my laundry, cleaning, all of that, because it's not just going to university and then just like coming back and then that's it. Yeah, you have to factor in time. And then also you have to factor in time for yourself, like because med school is really full, like it is full on. So you need to like make sure that you are also having fun, but also not having too much fun. I feel like the mistake this semester probably would have trying to find the balance between, um not going out every night and like, going to and then just going to all your lectures. So I think finding that balance, but I feel like that balance has been found now, but that was a tough adjustment. Yeah.
Yeah, no, I definitely agree. I think obviously now I'm in fourth year, it's a lot easier because this is my normal now. Like I find it harder to go back home in during the holidays and kind of switch off. But I think that was hard for me too. Like I think you do have to strike a balance between making sure that you have a life outside of medicine because you don't want to burn out. You don't want to, be spending 10-hour library days in first year because you will burn out. Some people can do it, but I think for most people that's not gonna work out. And I think I had quite bad imposter syndrome when I first came to medical school. I think I thought everyone was smarter than me. I thought that could I be a doctor? Am I good enough to be a doctor? And then gradually, I think you start to find your learning, your like what learning method works for you. If you're Anki, if you're not Anki, if you're like Quizlet or something, you start to find what you're good at quite early on. So some people they're very good at history taking. Some people they're a bit better at the skills aspect. Some people have the science nailed. There's so many different aspects to medicine. So the one thing I could tell all of you now is you do deserve to do medicine. You're clearly smart enough. And I think, yeah, trying to balance that imposter syndrome and realize that you do deserve to be here is something that I struggled with for a bit. But I think it does all fall into place, if that helps.
The imposter syndrome's so real. I feel like it's difficult because obviously there'll be people in your lectures who are really confident and outgoing and really do have it together, and it's so okay if you don't. It's just I think just making sure that you just like keep telling yourself that you are here for a reason, and not everyone's perfect. So yeah, just kind of believing in yourself. But yeah. Um
Definitely.
oh yeah, the next question was about the anything else that's really unique. I think Harriet has answered that.
Yeah, I'm going through a few of them and just picking. It's hard because truly unique. I think a lot of medical schools are like a little bit similar because they have to
Yeah.
be because the GMC regulations, they all have to do the same, like similar things. But I mean, from my perspective, having so many different kinds of learning is unique. Like I think it falls into a really nice kind of niche area where it's not traditional, it's not PBL, like non-traditional, but I think it's a perfect blend. So I think from my perspective, that's quite unique because I think other med schools take it too far on the other end of the spectrum for me personally. So I think it perfectly sits in that spot for me is the biggest thing that I'd mention.
I think research, Southampton's so proud of all of its research. It's like a
Yeah,
big, big, big thing. So if you do want to stand out, maybe have a look at the website and what research is going on at the university.
yeah.
I think can you give an example of the group task for interview and how you'd approach it? Okay, so just for the group, if you're just given like a problem to solve, like it will just probably just be a problem like Yeah, I can't even think of it, but basically how you approach it, they don't really care about the problem itself. They want to see how you work together as a team. So, like making sure that you're including other people and their ideas. How much are you contributing to the ideas? Like just making sure you're not just sat there um passively. Um, so the way you do approach it is just like kind of form a plan as a team, that kind of vibe, if that makes sense. Like, have I answered your question there? Please say if I haven't. Um, is there an option to do an integrated master's? Yes, so the intercalation, I don't know if Harriet wants to talk more about this, but it still is a thing.
Yeah. So if at the end of third year, you can choose whether you want to do like an integrated year. So I have some friends that have gone off to do that. And it just means that instead of going into fourth year like I've done, you take a year out and you do something different. Southampton let you do things in different medical schools. Some medical schools say you have to do something staying in their medical school, I believe, but they're very open here, at least I'm sure they still are, to you going away. So I have a friend that's doing, I think, women's health in London. I've got a friend up in Sheffield doing, I think, neuroscience BSc. So you can either do like a MSc or a BSc, I think. It just depends because the funding is a bit different for both. But because I didn't choose to do an integrated year, I don't know all the details. But the good thing is that they do give talks to you in the early years if you're interested in integrating. They do give you talks about it. So they'll know a bit more than me, unfortunately.
Just checking the next question.
Yeah, I'm answering some of them, but yeah. Hmm.
Uh, okay, so I think there's a lot more about the group task.
Yeah, I'll let you do that because you had one.
For the Southampton group task, what would you say is a good way to reflect on your weaknesses and improvements in a way that doesn't make it seem like you're not fit for medicine? I think reflection, like Harry would definitely agree, is such a big part of like being a doctor. Like they make us reflect now, starting from year one, week one. So and you're not going to be a perfect doctor. So I think maybe just about if you could, I think it's really difficult because you'd have to give me a situate like I can't think of a reflection on the top of my head in the sense that obviously nothing like you don't want to point out about the fact that you were talking over other people and things like that. But that's a
Yeah,
really
fine balance, isn't it?
yeah, it's a really hard question because I
Yeah.
think you just I can't even give an answer because it's difficult because I don't have a situation in uh okay, I'm gonna keep thinking on that whilst I answer the next
Oh
question.
yeah, there's one on whether you get both primary and secondary care settings in first year, and yeah, you do. So you get quite a heavy, as you mentioned, you get quite a heavy GP in first year, which I think is really important because that's all about history taking, and that is one of the essential skills that you have to be able to do. You have to be able to take a good history, and I'm so glad that I had a good foundation before I went on to placement because I can't imagine learning how to do that in like third year. Like I think I'm so glad that we had that basis in first year. And it does get quite like you get some really good advice from your GP, like you get to know them because you see them frequently. And then the secondary care setting, as you mentioned, I also did that 4 hours in ED, but you can also do the maternity one as well. I think what is there anything else in first year that they've changed? Because that's what happened for me. I think it's the same for you as well.
Um, yeah, I think that is just like it's just more heavily more GP
Yeah.
now, but yeah, the same with the 4 hour shift. And you just have to get them to sign a form and reflect on it. Um,
Yeah. Oh, the modules. The modules have changed. Someone was asking about because they applied last as an undergrad in the same year that I applied. The modules have changed because I did modules in first year that you now longer do no longer do, from what I'm aware. I don't know if you know some of the modules that you're up to at the moment.
um, yeah, so the way our modules work is we have applied knowledge one, and then applied knowledge two. So that what that is, it's all of the medical science stuff. So the immunology, the pharmacology, the oncology, hematology, it's all of that. And the reason why it's applied knowledge is we're given a case for the week, and all our like learning is based on the case. So, for example, if we're looking at a respiratory disease, like for example, asthma, we're looking at the immunology of asthma. We're looking at like the pharmacology of the drugs used. It's all like the medical sciencey parts. That's what the applied knowledge is. And then you have the research module. So some of our lectures about research and statistics, and then about how research works and like specific things that you need to know about research. We have health improvement module, which is a module where we have to work in a group to produce a poster about an issue, like a societal issue. For example, my group, our project is on dementia. So we're making so like our project idea is to have dementia cafes to help those people with dementia. So that's the kind of thing. Those are the types of modules that you have. I'm trying to think. Those are like the three main ones, but the applied knowledge modules are just like everything clinical and like medical science applied. Yeah.
That's so interesting to me because what we were saying earlier about they really care about feedback. That's some of the stuff that we were talking about when we were back in first and second year. So there you go. They do listen to you guys.
Yeah, they were saying that like all the older years had been complaining, like, and they're not complaining, but just been like they would prefer it. It would be more helpful if it's taught in a certain way. And I guess my year is just
Yeah.
really lucky in the sense of getting that now. But it,
Oh,
yeah.
sorry, not to interrupt you. Somebody was asking about what the group interviews looks like on the day. I don't know if you could say something about that.
So you're put in your group, so you like arrive for your set like time slot, and they'll basically just be um fourth years, third years, just kind of talking to you, a medical student, just talking to you and just kind of reassuring you. And if you have any questions, you can ask them. And then they take you for your group task. So they take you to a different room and you will just sit around a table and then there'll be like three examiners like in the room and they'll just be taking notes and they'll basically just like get you to read the group task, they'll read it out for you and then they'll start the timer and then from then on you just have to kind of do the group task. Yeah, I think that is just it, if that's clear enough.
Cool. Uh, Before I mention one of these questions, there's quite a few comments coming up of people saying they haven't finished like some things they put in their personal statement or what to do if you really don't know. Um, I won't mention the question because we're not meant to, but I had a question in my panel interview that I didn't know the answer to. Like I actually just didn't know. And I was really honest and I said to them, I don't know. I'm sorry, like I'll go away and research it. And the guy said to me, do you want to guess? And I said no, because I didn't want to guess. And I was really upset afterwards and thought I'd ruined my interview, but I got in. So I think the biggest thing I would say is be honest with them. If you don't know, you don't know. Like, there's nothing wrong with not knowing. We can't know everything. We're only human beings. So I think if you really have no clue, if they ask you something and you've got not a clue, it's okay to say, I'm really sorry. That's not something that I'm aware of. I'll make sure to research it before I start medical school so I fully understand. And I think that's a good enough answer in itself. I think they'd respect you a lot more for saying that than completely um, kind of pretending that you know, because it's really obvious when you don't actually know what you're talking about and you're trying to give it large. So that's just a bit of advice. But someone then mentioned the differences between tutorials, seminars, and lectures. So lectures are, as you imagine, it's the whole year group in a lecture theatre, and one of the professors will give a talk on a specific topic, normally with slides for like 45 minutes-ish, normally. Um, so that's quite passive. So you are normally just sat there, making notes, annotating slides, whatever, however it is that you learn. Um, yeah, tutorials and seminars, the line blurs a wee bit. Seminars are kind of like more interactive lectures, would you say? I'm trying to think about, yeah.
Um, so so the way I think about it is lectures and tutorials are linked in the sense that with lectures you'll be taught something, like for example, the immunology of asthma, just so how like the immune system works with asthma. And then in the tutorial, there'll be five of you and one like teacher, like professor. And basically, you sit down and you try the question, they give you questions, and you try those questions and like after you do one question, you'll discuss the question with the professor, and then you do the next question. So like lectures and tutorials are linked. Seminars are just like there'll be 30 people in a seminar, and they'll just kind of it'll just be it's a mini lecture basically. For example, it just like for example, we had a seminar on X-rays, like and the different pathologies for lung conditions. Like that's more interactive in the sense that you can participate and discuss in a group of 30 people and put your hand up. Whilst yeah, so I think that does that kind of make sense? Please just say if what
Yeah,
I'm
made
saying.
sense to me. And then someone said you do no work at weekends, exclamation mark, exclamation mark. That's the one thing about university that's quite different to school. So obviously when you're at school, you have homework, and that doesn't really exist in the same in like at university. It really is you do however much you want to do. So if you go to lectures, there is no obligation for you to actually make notes. There's no obligation for you to make Anki. There's no obligation for you to like revise the content. I mean, technically, you could show up to anatomy having not done the prep work.
Yeah,
No one's
but
checking that you're doing all these things in the background. But take it from me, life is a lot easier when you do the prep work, when you make sure you understand the lectures, when you keep on top of the work, because things do build up quite quickly. So I wouldn't say that there's nothing scheduled on the weekend, but when I was in first, second year, I normally made sure that I reviewed content at the weekends, and I made sure that I prepped for anything coming up the next week, whilst also having a weekend. Like I also had a week, like, had fun with friends, went out, all that stuff.
like something I've learned from the first semester is the importance of the weekends. Like
Yeah.
especially with like because there's so much content, like you can't revise everything if you're not utilizing your weekends. Because the exams they go over everything. And yeah, weekends are so important. So I like yeah. And like we don't really get assignments as such, but that's because you spend all your time trying to, decipher what's going on in lectures, making notes. Like that takes up so much time. I do have to go soon, but someone had mentioned Time for Dementia. So Time for Dementia is a program uh where we visit families. So there'll be like five of us who go visit a family of like someone who has dementia. And we spend the afternoon with them. We play like card games, board games, just chat to them about their life, to like have a better understanding of the condition, but also to practice our bedside manner, like that, like it's opportunities like that which like make Southampton really, really special. But yeah, I'd completely forgotten about Time for Dementia. But yeah, that is a thing. And I've got we get assigned a family and you see the same family if like a few times in a year. But yeah.
You can go if you want to. I can do like another 5 minutes of questions if people have any burning questions. So don't worry if you need to run.
Yeah, I'll stay for 2 more minutes and then I think I will have to.
Okay. So during the panel interview, no, they both of them asked questions. They sort of alternate. Well, they did for me, they kind of alternated between questions. You can sometimes have like a good cop, bad cop situation. Like some of my friends had that apparently. I would say one of the people on my panel was like a bit more serious than the other one, but I wouldn't say it was like bad cop, good cop. But don't let that throw you off if one of them's being difficult and one of them's being nice. Like sometimes they play it that way. It's just a strategy. Um, but yeah, they do tend to balance the questions between them, definitely. Um,
Yeah, for my panel, the two doctors, they were really lovely. So I think it just depends on who you have and like what they're trying to get out of just
yeah.
interviewing you. Um, yeah.
Just
But
don't let them psych you out. Like if someone is being a bit weird or being very serious, it's not because your answers are terrible. It's just the way that they are. Like sometimes I think the vast majority of people that I know had lovely interviewers, but just in case you have someone that's a little bit serious or that throws you off a bit, it's not you, it's them, as the saying goes. So don't let it stress you out.
yeah, the program is called Time for Dementia. Uh, for those who, yeah. Okay, I think I'm good. Do you have to go now?
Yeah, no, I can
I
stay
will
around for a
be.
tiny bit longer if anyone has any more burning questions.
Yeah, I hope I'd answered all your questions regarding preclinical years. Um yeah, if you do have questions, Harriet can always message me and I'll stay on my
Yeah.
phone just to but yeah, thank you so much. I'm gonna leave now.
Thank you.
Bye.
Bye. Okay, if anyone has any more burning questions, I'll be around for like another 5-ish minutes. So if anyone's not answered something, but as we were saying, they've recently changed the course slightly, so preferably don't grill me about the early years stuff, otherwise I'll have to pass it on. Um, how long should you spend per question? Really difficult to quantify. I always say try to avoid waffling because I think sometimes in panel interviews, people, because you do have a bit more time, people go off piece a little bit. So I would say try to stick to the question. Don't be like, talking and talking and talking. I think it's still fine to be succinct, but you do get a little bit longer. I think it's very hard to quantify, to be honest, but you can elaborate a little bit more if that helps. I'm sorry, it's probably a little bit vague, but it's hard to quantify. How did I prepare for my interview? I got family members to read my personal statement and come up with questions for me. I'd recommend you guys doing that because that's free. You can just ask people you know, especially teachers as well. You can ask teachers to come up with questions for you. That's really helpful. See if any teachers at your school will do mock interviews for you, if that's possible. I personally didn't buy any courses, but I do think that that's a good thing you can do. And MyUCAT are very supportive with that kind of thing. And I also do interview tutoring for MyUCAT for Southampton. So if that's something you're interested in, then that's always an option as well. Um, how have I been finding placement? I love it. Genuinely, I love placement. Obviously, you get days where it's not as fun, or nothing much is going on, or somebody ignores you, and it's definitely not as fun then. But overall, genuinely, it's so much fun because you're finally at the point where you feel like a doctor. Like I go on the wards and people mistakenly call me doctor because I'm in scrubs with a stethoscope, and it's what you dream of when you're applying. So I really love placement. I really love it. It's a little bit difficult to adjust to the longer days sometimes because you have a little bit less free time than you did in first and second year. But you are doing things that make you feel like a doctor, so it's worth it, in my opinion. Um, what year has been the most difficult? Oh, that's really tough. Oh, they all are difficult for different reasons. That's the thing. Um, hmm. I think second year was one of the biggest jumps from first year, but I think that's one of the things they're changing. So don't get freaked out by that. But when I moved from first year to second year, I think I struggled a bit with the content because it was spiral. It started going over things in more detail and I started to get confused. But there was support there for me, and gradually I got to grips with the content and it gets better. But the beginning of second year was quite overwhelming from memory. But every year is just different. Um, How much value is placed on your EPQ? I don't know. I never did one, but I do know that they'll probably ask you for your findings or to talk about it because it's interesting. Like I'd want to ask somebody about their EPQ if I was interviewing. Um, oh, I should have said, um, kind of like practice questions for you guys for interviews. I don't have any specific practice questions, but I would definitely say make sure you know how to answer the skills questions because they do like to ask you things like when have you demonstrated empathy? When have you demonstrated good leadership skills? Those are really important questions to be able to answer. Make sure you can talk about all the pillars of ethics. So if they ask you to outline autonomy, if they ask you to talk about like non-maleficence, that's really important. It's hard to generate questions for you guys because your personal statements will all be different. But it's those kinds of questions that you want to be thinking about. Um, Books. They might ask you what your biggest takeaway from a book was that you mentioned. They might ask you to talk about it. I didn't mention any books in mine, so I honestly can't tell you a definite question, but they might just check that you've actually read it, is what I'm hinting at, I guess. But God, I really hope this is helpful. I feel like I've been rambling a little bit, but when I was applying, I there were no doctors in my family. We didn't know any doctors. I had no idea what medical school was going to be like. So I just really wanted you guys to feel like you knew a bit more about what it would be like. So I hope that we've achieved that today and that maybe you know a little bit more than you did before about what medical school can be like, hopefully. Kind of like I probably need to leave in like a minute or two. So if anyone's got any really burning questions in the next minute, I'll hold on, but otherwise, guys can feel free to go. Good. Thank you guys for coming as well. I really appreciate you guys listening to us talk about our medical school. Thanks, guys. And good luck, everyone. Good luck with your interviews. I hope they go well. Hopefully, see you in Southampton as well.
Amazing, guys. Thank you so much for joining today. So, this was Southampton. We had Imperial yesterday, and we have loads more dental and medical schools coming up. So, keep an eye out for those. They're going to be sort of in the next week. So, looking forward to seeing you all there. Thank you so much, Harriet, as well, for your time and
Right.
your really insightful tips.
Good. Thank you, guys. Okay, I'm gonna head now because I have to drive back, but thanks, everyone.